All right. Well, this is super, super exciting. Welcome, 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 everybody. And let's start with some introductions. I'm Dr. Edward Nejat, co-founder and practice director at Generation Next Fertility. Nice to see you guys. And with me, I have Mary Sabo.
My name is
and
Dr. Mary Sabo. I'm a doctor of acupuncture and Chinese medicine. I'm founder of Lily and Horn Acupuncture Clinic. We have locations in Chelsea and Southampton. And I've been practicing for over 15 years, and I've been specializing in fertility and integrative acupuncture for all of that. And by that, I mean helping women both with their natural fertility, but also during assisted reproductive technology cycles, like what Dr. Nejat does. So I think the use of the medicine, and I know some people have questions about this, doing what I do, it's very natural. It's all about getting the body into balance and optimizing fertility. But sometimes Western medicine comes in and does really cool, aggressive interventions that are super effective. And our medicine then does a supportive role for that. So it's, I think, a little bit of a different use for the medicine. And as I've been going through my career, I've really been focused on kind of developing those techniques. It's not something that we necessarily learned in school. It's more obviously in ancient China, they weren't doing IVF. So it's kind of evolving as I go, really understanding how to support patients undergoing IVF, IUI.
It's amazing. And Mary and I have been working together for, I would say, the better part of a decade now. And her philosophy, as you just heard, meshes really well with Generation Next, because as most of you may know, we really do specialize in optimizing people's natural fertility and using natural fertility to help boost the treatment options that we have available, like IVF, and perhaps more specifically, mild stimulation IVF and natural cycle IVF, which really do heavily rely on women's hormones in order to achieve success, rather than the more conventional stimulation cycles, which also have, a good role for the right patient. But, in some of those cycles, the dosage is much higher, and the control of the female's hormones themselves tends to be more heavily outweighed with the conventional stimulation cycles compared to the natural and the mild cycles. Okay.
Great question.
Why are you so passionate about what you do, Mary?
I can answer this in several ways. I got into Chinese medicine, actually. I was pre-med in undergrad, so I love Western medicine, and I wanted to practice medicine. As I was going through the process of looking at the medical system and deciding on how I wanted my role to be in my career, I really wanted to help people live like healthy, abundant, like fantastic lives, not just silent symptoms or like manage the body like a machine. And so I really gravitated towards Chinese medicine. I first got into Taoism, and then it led me to Chinese medicine. And then the fertility piece was just really wanting couples to be able to conceive when they're ready to conceive. And the truth be told, I kind of struggled in school with accepting Chinese medical theory and just like buying into it, because I worked at a couple medical schools doing research, like in between undergrad and grad school. And I really the Western medical model was ingrained in my brain. And so I think the Chinese medical system is very theoretical. It's very abstract, and you apply the theory to each patient, which is beautiful because you customize everything then. But my brain was kind of like, yeah, but what's right? Where's the right thing, right? But when it came to a woman's cycle and the hormonal changes throughout the month, and the way different women present with like PMS or cramping or digestive changes, like that all made sense to me when applied to the Chinese medicine theory. And so I crushed it with every patient. Even patients coming in for migraines, if they weren't on the pill and I could see their cycle and I could fix their cycle, I would fix their migraines. So it just I naturally kind of gravitated towards that direction. And then once you help a few people conceive, it's just spreads like wildfire, right? But I really love the Western medical piece too.
That's
and so
amazing.
I have driven my career in a way that integrates with it. So I really feel passionately about supporting what you do to help women. I think it's the best of both worlds then, right? Yeah.
Totally. I totally agree with that philosophically. And, you know, going through medical school, residency, fellowship, acupuncture was really not emphasized. And it was only when I was after my training, when I really began to get some exposure to it and started working with you and some other acupuncturists, when I really began to understand how valuable of a treatment option and a complementary integrated therapy it can be for fertility patients. And I think that's a really missed opportunity for a lot of people. And I'm really glad to have the opportunity to do this with you to get the word out, because acupuncture can really be a beautiful complement to everything that we do, whether it's IVF or IUI or just trying naturally. And I think there are myriad benefits for patients that are, it's, you know, from my angle, it's more difficult to really, we can't, like, you know, research wise, everyone says, what's the research about acupuncture? You know, does it really improve outcomes? Fair questions, I think. And there is some good research out there that tries to really measure the influence of acupuncture on fertility treatments, and feel free to jump in at any point here. But acupuncture is not just one thing. It's so complex and technically involved that to actually study like one single piece using like a rigorous Western scientific method really doesn't do justice to trying to make the determination.
And there is,
I
do want to talk about the research, because there are adequate studies now that demonstrate some of the specific ways that I see clinically acupuncture really helping. But I think what you're getting at is, and what I've alluded to, that acupuncture is so customized. Like every time we see a patient, we are talking about their digestive system, their sleep pattern, their energy, their immune system, whether or not they have headaches or PMS. Like everything is just completely customized, and that's the beauty of the medicine. But that makes it really hard to study. So in order to create a good, effective study and do a double-blind, placebo-controlled, you know, study with acupuncture, you would have to have everyone have the same pattern diagnosis in Chinese medicine, which it gets complicated because usually people have multiple pattern diagnoses. And by, you know, I say patterns, we diagnose the body in patterns. So we never just say like infertility. We say, okay, this woman is having a short luteal phase. She's also experiencing extreme fatigue. She has trouble sleeping at night, and she has loose stool a lot. So like that's a pattern for us that we would treat the whole body. And so it's not just like, oh, poor egg quality. It's, you know, it's like much deeper. And then everything, the herbs, the acupuncture, we give diet advice, we give targeted supplements. I like to use supplements that have been shown in studies to be helpful for specific Western things, you know, issues with fertility. But we do a whole systems approach to that. And that actually, my friend Lee Hollander Rubin did a study of patients undergoing care with an acupuncturist in the months leading up to and including their IVF cycles, and the live birth rate was significantly higher with women who did that. So that alone is looking at, she called it whole systems TCM, whole systems traditional Chinese medicine, where it was like people who do the whole shebang and work with an acupuncturist to prepare their bodies even before doing the IVF and during the IVF. We don't do herbs during IVF. We defer to you guys to control the medicines. It's such a controlled cycle. But, you know, optimizing body chemistry, I like to say, in the months leading up to the IVF can help live birth rates. So it's not just getting a positive, it's not just getting a euploid embryo, it's actually getting the patient to the baby in their arms.
I love it. It's so perfectly what's missing with Western medicine, because, you know, when as physicians, the way we're educated and trained is, you know, let's figure out the one thing that's preventing people from getting pregnant and let's address it. Oh, the tubes are blocked. Oh, it's an egg quality issue. Oh, there's something with the uterus. And like, that's, you know, we try and zone in on that one thing and then ignore really
but it's wildly
the entire
important,
rest of the body,
you know,
which really
because
logically
sometimes
doesn't
there's a
make
barrier.
sense.
Like I think
you know,
of
maybe
conception
from
as and this is my
Totally.
own little wacky like spiritual theory, that like a soul's like coming through this like portal or pipeline or something trying to get in, but if there's a barrier, it can't get in. So like our jobs, my job is to optimize the body and, you know, help, you know, increase health and fertility naturally. But your job, you guys can figure out, is there a barrier? Like, are the tubes blocked? Are the eggs poor quality? Let's get as many eggs and weed out the bad ones. Infertile, you know, like this is an incredibly important piece that, you know, that's why the two work so well together. Because like I can't figure out if the tubes are blocked. You know, I can't open tubes.
Exactly.
It's far more effective to do an IVF. So I think we need you to focus on that issue, on the barrier.
Right.
Yeah. Yeah. Yeah.
Totally.
I think so too.
And that's why the collaboration is so powerful. We have a question from the audience. How does the acupuncturist diagnose a patient? Ooh, that's like a whole course load of years of experience.
Actually, in each initial acupuncture session, when I see a patient for the first time, we go through the entire fertility history, any Western medical diagnoses or, you know, blood work or any information that a patient has is useful for me, just because I've been doing this for so long. But then we're also looking at the natural cycles and like, you know, the symptoms associated with it, which a lot of patients think are normal because they've always had PMS or cramping or, you know, 24-day cycle, which, you know, we would consider short. We're looking at changes in that and how we can optimize and get that patient to maybe a 28-day cycle, ovulating around day 13, 14, no PMS, no cramping. That would be like, you know, 4 days of good flow, the first two the heaviest, bright red blood, no clots, no spotting. Like this is a stereotypical goal that we would work towards with natural fertility, and any variation helps us understand the underlying pattern. But then we're also looking at their digestive systems. Like, do they poop every day? Do they poop 3 times a day and it's loose? Like that, those differences plug into the equation. And again, we, you know, like I said, we look at sleep, we look at energy, we look at the lungs, the immune system. Right. Are there any heart issues, any history of diabetes, any, you know, problems with energy, any pain anywhere? Like this all goes into our equation to help us understand the underlying Chinese medicine diagnosis. So we make that diagnosis as a pattern, as like the whole body, and then we prescribe the herbs and the acupuncture points to fix that problem. So like a diagnosis in Chinese medicine would be like liver qi stagnation with spleen qi deficiency. It's like very theoretical and just like labels for the patterns that help us choose the points and the herbs and then make dietary recommendations.
Awesome. Love it. Okay. There were a couple questions submitted by the audience beforehand that I'll touch on. Is there a specific fertility acupuncture type, or is it unique per person? I mean, I think
it is, and I want to say that any
very individualized
acupuncturist can help fertility. So I know sometimes people are, you know, a lot of people are in New York watching this, but people in the rest of the country, if you're watching and you don't have an acupuncturist in your area who specializes in fertility, they would still know how to balance your cycles. They would still be able to help. First and foremost, acupuncture helps balance the nervous system, taking you out of the stressy fight or flight state and putting you into more of a parasympathetic state, which that alone reprioritizes the reproductive organs. Like we see that. So like any acupuncture will help fertility.
Absolutely.
But if you have the option to work with someone who's very experienced or specializes in fertility, that's preferred. And especially if you're working with a reproductive endocrinologist and undergoing any treatments, I think it's crucial, if possible, because like I said in the beginning, like the use of the medicine changes. So when I'm working with someone naturally, I have all my tools at my disposal, the herbs, the supplements, the diet changes, whatever. But when I start sharing a patient with you, I kind of take a back seat, and this is just my style, because I know your treatments are aggressive and I use the medicine to enhance what you're doing. So I use this example of like doing a 2-month break of Lupron prior to an embryo transfer if there's like a history of failed implantation with euploid embryos. Like sometimes we do this if the if the receptiva is positive, you know, we'll do 2 months of Lupron. Lupron puts a patient into a low estrogen state. Yeah. And the goal is to reduce inflammation from potential endometriosis, right? And to help those receptors express in the uterus and to lower. Thank you. So a low estrogen state in Chinese medicine is called kidney yin deficiency. A lot of those symptoms like it's called kidney yin deficiency. Kidney yin deficiency. And so the symptoms are like hot flashes, night sweats, irritability, like kind of agitation, and we call that yin deficiency. If you don't understand the goal of the treatment, you might say, oh, this patient has yin deficiency. I'm going to give kidney yin tonic herbs to nourish the yin, but most of those are estrogenic, which is like counterintuitive to the goal. We want to keep low estrogen so we don't stimulate the endometrial cells. And then what we want to do is clear heat in Chinese medicine and reduce inflammation. So that it's like a little bit of a different shift in thinking of what is my goal when I treat a patient with ART versus the goal is always to keep the patient in balance and listen to the body when we're doing natural. But when we're doing ART, the goal is sometimes to throw the body like wildly off. And so there are some side effects, but for a good reason. And so I don't want to fight those side effects. I want to understand how I can help a patient through the process and like help, keep them going, help them manage anxiety, but I work to enhance your treatments.
That's awesome. I love it. I love it. Another question from the audience.
This is tiptoeing into territory of the typical answer is no, right? Like AMH is kind of fixed, right? AMH is a reflection of, and you can probably explain this better than me, of the quantity of eggs in the ovaries in each batch coming down the pipeline. Exactly.
That's correct.
And so
not necessarily the quality.
I don't see that changing much. I think we've all seen like occasionally some patients improve, whether it's like they had just come off the pill when they did their AMH and the ovaries were just like really suppressed. But so in general, I say like no, but like I have seen cases where it does help. And, those are the little, kind of exceptions to the rule, I think. However, we can work on optimizing the rest of fertility and including when it comes to IVF with low AMH. One study showed that acupuncture, when included in stimulation cycles, helped a patient get more mature oocytes out. And so I think we both know that has to do with like timing of the trigger and like the medications. And, it's not just acupuncture, no acupuncture. I think there's like a lot more to it, but they did show a significance in a study that like patients who included acupuncture had more mature eggs retrieved. So, just trying to optimize what's there.
Yeah. I think that makes sense. And AMH is, one single test that sometimes maybe gets more weight than it deserves. Yes, it's a data point, and I think it's a relevant one, but it's not the be all and end all marker of fertility by any stretch. So that's also important to keep in mind from when we're talking about AMH. Okay. Good. We covered some of these questions. How many sessions of acupuncture would you ideally want to do before someone were to start an IVF
in a perfect
cycle?
world, I would say 3 months. Like if you're just starting to think about doing IVF, maybe a few months away, starting at the 3-month mark before you would start the cycle would be ideal, just so we can optimize body chemistry because the eggs are kind of maturing as they come down the pipeline in your body chemistry, right? And so I don't think that we change egg quality. I think that we change body chemistry, and that helps the eggs be their best selves. So age, it is normal to have a decline in egg quality as we age, but like sometimes we see patients with poor egg quality at a younger age that we can impact the egg quality sometimes drastically. And I think we do that by addressing body chemistry. And so that gives us a chance to make some changes and let the eggs coming down those 3 months pipeline have a full cycle of maturation before being retrieved. That being said, if you're about to start an IVF, it's not too late. Studies have shown at different points of adding acupuncture that it's like almost always beneficial. when it's studied correctly. And, you know, there's multiple ways to try to study acupuncture. But usually looking at studies that do acupuncture versus no acupuncture, there's no placebo. But when patients look at, or when we look at like sham acupuncture, it gets really complicated and it's kind of isn't as clear cut. But usually acupuncture versus no acupuncture shows an effect. So, so for a while they were trying to create a placebo
to
sham
study
acupuncture and not let patients know that they were getting the acupuncture or not getting the acupuncture. And so they created this like device that sits on the skin and it looks like a needle goes in, but it collapses and it doesn't pierce the skin. But it's like still a conductor. And so at the root of Chinese medicine theory, we're affecting the qi in the body, the energy. And we know that, you know, there are like charges going through our body and our cells and our atoms are, you know, like, so there's always still an effect with sham acupuncture. And whether it's just like the patient thinks they're being treated or if we're actually having an effect, just even not piercing the skin with a needle held over it, like, I don't know. But it'll be like the no acupuncture group did not do great. The sham did okay. The full acupuncture group did better, but there wasn't enough of a difference between sham and acupuncture to say it was significant. Does that make sense? Yeah.
Got it. Yeah, totally. Very, very interesting.
I mean, if you
can acupuncture do harm
like right here and you go too deep, you could pierce the lung, right? So like that kind of harm, so most licensed acupuncturists go to school for 4 years. I went to a 4-year program. I did an additional year of a doctorate. So people who have a license in acupuncture know not to do that. There are like almost no instances of adverse effects in terms of like organ puncture, which would be like the worst case scenario of like doing damage. It's when people get acupuncture like dry needling from a massage therapist or like a physical therapist or something, a physician who just did like a weekend course, that some adverse events have been recorded. But when it comes to fertility, if you're working with a licensed acupuncturist, it is safe. Whether they can mess up your fertility, I think that's a broad statement. Like, you know, as we talked about earlier with like the Lupron, it depends on what you're doing. Like if you're doing IVF and you don't have someone familiar with it, hopefully they'll be very gentle and just supportive. But, you know, I don't think they could like mess up the cycle, but it's far better to work with someone who's really familiar, especially if you're doing IVF.
Yeah, I totally agree with that. And in all my years of practice, and I've referred many patients to acupuncture,
it's really hard
I've never
to do that
like had someone come back and like been like,
gentle,
oh my God,
potent when
nothing like that. Yeah.
Absolutely. Awesome. Yeah. We're really well known for.
Do you have male patients for male factor?
But we see male patients all the time. Acupuncture and especially herbs and supplements have been shown in studies to help improve sperm parameters. I think count and motility is easier to treat than morphology, but we have had success treating morphology, especially with diet and lifestyle changes.
Interesting. That's interesting. You know, morphology is one of, just for the audience, is one of the parameters that we look at when we do a semen analysis. The 4 most important parameters are the volume of the ejaculate, the concentration or the quantity of the sperm, the motility, the way the sperm move, and the morphology, also important, but more and more research is demonstrating that morphology as an independent marker there's so much variability in determining morphology, whether it's variability between 2 different technicians looking at sperm, and now there are these automated systems that are used to determine morphology. And there's more and more emerging research that really questions the utility of morphology in diagnosing male factor infertility. So I just wanted to throw that out there when you brought up morphology, because in my practice, when I see a little morphology, I don't ignore it, but I don't think it's nearly as
especially for IVF, right? Because you
see
select the good
low
swimmers
concentration or low motility
who are shaped correctly. Yeah. Yeah. So as I'm going through my career, I've zeroed in more and more on endometriosis. I think, and I don't know if you'll agree, that a lot of unexplained infertility in women is likely endometriosis. Excuse me, and we can do a lot for endometriosis.
Yes,
it's all from inflammation, right? So endometriosis is when tissue and like cells from the inside of the uterus that grow and shed each month, the endometrial cells, escape the uterus. It's usually through the fallopian tubes or from some injury, and they implant elsewhere in the abdomen. So like on the outside of the uterus, the fallopian tubes, on the ovaries, on the intestines, the bladder, the membrane that encases the organs, like it can be anywhere. And so these patients I often see, you know, some, like the classic symptoms, as you know, the classic symptoms are like severe, intense abdominal uterine cramping during the period. But more and more we're seeing patients who don't have any symptoms, and they go through the infertility or the fertility process, and nothing's making sense. Sometimes I see women going on to do exploratory laparoscopic surgeries, and lo and behold, they have endometriosis, and they remove it, and then fertility improves. Not always, and like not all women get to that point, but sometimes doctors send me those patients where it's like, you know, nothing's lining up, like this isn't making sense, or this patient has really poor egg quality and they're only 32, can you help them? And so when I see these patients, I really try to focus on inflammation. So we do a low inflammatory diet. We cut out like processed foods and sugars, alcohol, caffeine, or at least reduce those. We focus more on like a Mediterranean style diet with whole grains, good quality fish, protein at every meal, high quality organic fruits and vegetables, especially berries, any food that's anti-inflammatory or high in antioxidants. And then we do herbs and acupuncture and supplements to focus on balancing their system according to their Chinese medicine diagnosis, but also working on the inflammation. So there's also an immune component that patients can experience with endometriosis. Sometimes the immune system gets kicked up because they're their own cells where they shouldn't be, and so the immune system gets confused. And so studies have shown acupuncture can help regulate the immune system too. However, I think in cases that are severe, like what we do is just sometimes not quite enough. And so doing more advanced treatments with you guys, like steroids or, you know, treatments that help suppress the immune system, along with selecting the best embryo with IVF, seems to be, you know, a more aggressive, effective approach.
Amazing. Amazing. Well, we're coming up on time. Anything else you would like to
there was one about
talk about or add?
All the
or any other
things
questions from the audience?
Can do, and I just wanted to quickly run through a list of things that are backed by research that I see clinically too, and that is increasing the thickness of the uterine lining. So women struggling to get a thick lining, such a tough problem. Yeah.
Such a tough problem for us
because
sometimes.
Acupuncture helps increase blood flow to the uterus and ovaries.
Please help.
There are also some tools that I use for like supplements, herbs with the physician's approval that we can add that can just tip us over the edge of like getting from like 6.5 to like 7.2, which makes a big difference, right? So those patients, we can really help helping balance hormones naturally during natural cycles, helping women who are not ovulating start ovulating. So hypothalamic amenorrhea, PCOS, either irregular long cycles or just anovulation in general. We can help those women start ovulating. We talked about reducing inflammation, especially for endometriosis, but also for autoimmune conditions. So I have some like Crohn's disease and ulcerative colitis where there's just like inflammation around that area that can maybe negatively impact fertility. So getting that under control and using these tools can help. And then optimizing IVF cycles. So we do once a week acupuncture usually when we're working with a patient, naturally or in lead up to an IVF cycle. And then during the stimulation phase of injections of an IVF, we do twice a week acupuncture to really try to like optimize and bring as much blood to the ovaries as possible. And then working on a thin uterine lining, we would also do twice a week.
Amazing. I love it.
Thank you for having me.
All right. Dr. Mary Sabo, thank you so much. I just have a couple of announcements for everyone. Next IG Live is going to be next Thursday, January 26th, 4:30. That's our slot. Generation Next IG Live every Thursday at 4:30. Dr. Janelle Luke, my partner. Woo! Why AMH testing is important. Okay, great. And that's in preparation for Generation Next's newest initiative, which is DOR Week, Diminished Ovarian Reserve Week. For that, we're teaming up with Pregnantish for a week at the end of January to early February of educational content across our social media platforms to spread awareness and to destigmatize DOR. And this all leads up to our event on Thursday, February 2nd from 5 to 7 p.m. in our office, 57th Street between Park and Lex, where we'll be doing free AMH testing. And if you'd like some more information, please click the link in our bio, check out our website. And also remember, we have our Candid Conversations, which is a support group for patients, Wednesday, February 1st. It's a peer-to-peer support group, and that link is also in the bio. So thank you all so much for listening in, and a very special thanks to Dr. Mary Sabo from Lily and Horn Acupuncture in Chelsea and Southampton. Take care, everybody. Bye.